I'm ready. Good afternoon. Thank you for joining the briefing here at the EMA office in St. Clair County. Welcome everybody on this Sunday afternoon. Chairman Kern is with us again today and he'll be talking shortly, but Sam Bierman from the Health Department. Sam, it's day after day, numbers keep increasing.
They are, and it's clear we have not hit our peak yet, as you guys will see with today's numbers. As we have done in days past, our numbers are reported for St. Clair County residents that have been tested. Currently, we are at 588 that have been tested. We are at 82 positive, which is an increase of 4 since yesterday, and that is a female in her 50s, a female in her 40s, a male in his 70s, and a male in his 40s. We are at 363 negative tests, 143 pending, and still remain at 3 deaths. For state totals, we are at 58,983 that have been tested, 11,256 that are positive, which is an increase of 899 since yesterday, and we are at 274 deaths, which is an increase of 31 since yesterday. And I know I said yesterday it never gets easier, seeing that number rise in the death column, and of course all of our thoughts and prayers go out to the family members who have lost loved ones to this virus, and out to those first responders and medical care professionals that have taken care of them. So now I will hand it over to Chairman Kern for his update.
Thank you, Sam. Stopping the spread of this virus is a community effort, and whether it's our first responders that we rely on all the time, our doctors and our nurses who are putting in long days and many days a week, or whether it's the people who are just rising to the task and are donating items like Vortex Chemical donated bleach earlier in the week. And today, Trish Maddox came in and donated eye protection for us to give to our first responders. She brought a big box of goggles, and so we'll be distributing those to our first responders. Only if we're all in this together, and everyone has a part to play, whether it's just staying home, are managing the people that you're responsible for, your children, to make sure that they're staying home and in place. These are all important things to stop the spread of COVID-19. If we do this, we will all come through this much better. There'll be fewer deaths. We'll have fewer problems in the long run. So this community is coming together. St. Clair County, the first county in the state, has always been strong, and we're going to be strong through this virus and beyond. Today we're joined by Bethany Herkler. Bethany is a second grade teacher at Muscuda Elementary, and Bethany has come here today to talk to us about how kids are dealing with this, not being in school, but schooling from home. Bethany, welcome.
Thank you. Thank you so much for having me. I appreciate it.
So tell us, Bethany, you're a second grade teacher. Gosh, these young children, this is something they're not used to, being at home, being educated from home. Is it more difficult for you to teach this way?
I would say yes. As much as we try to encourage parents and our community to help with our online programs, whether it be different subscriptions that our school has assigned, or through Google or paper pencil packets, nothing can take away from the face-to-face instruction and the conversations that kiddos have. So, we miss the hugs, we miss the handshakes, we miss the high fives, we miss all of the noise and the conversations and discoveries that they make in the classroom. But we just have to keep in mind that we do want them and their families to be safe and be healthy. So we're here to help however we can for parents.
Has this virus, have you been able to bring this into the curriculum that you're teaching? Is this something that's brought into the lesson plan, or is it something that maybe you're letting the parents talk to their kids about, and you're just going on with the lesson plan as was designed back in August when you first started?
We definitely adjust our lesson plans frequently, but before we let out at school at Muscuda, there were some programs, for example, like Brain Pop, who sent out videos about hand washing, and for the older grades actually sent out videos that discuss COVID-19, because whether or not we were talking about it, they were hearing at home, and then we were talking about it at school. So right now we just really encourage kiddos to wash their hands, make sure you're safe, make sure that you make healthy choices, and just listen to your families.
So how are you measuring the performance of your students? They're doing their homework, but are you testing, online also, or is it just that you're trusting that the parents are guiding the kids and making sure that they're learning?
We are very thankful to have online programs that we are able to log in and track their progress. So we can see, for example, how many kiddos log in per day, how many questions per answered into specific subjects, and the percentage of accuracy. So we can communicate with families through email, we communicate through with administration, whether it be through Zoom or email, and to keep them updated on progress. And also we can make phone calls to home and check in.
Have you had any students drop off? I guess that would kind of be an online truancy. Are you having any problem with that, or are kids pretty motivated and families pretty motivated?
I would say we're on the uphill. This is new for everyone, so the amount of kiddos that were on when we started this online learning, it was less than what are on now. So in my particular grade level in second grade, we have most of our kiddos on Google Classroom, and more are logging in probably every day as their families become more comfortable. Because even at the elementary level, it's not total independence. So a lot of these families are working more, or if they're in the medical field, or maybe grandparents are coming over to babysit, or maybe they have multiple children that they have online learning to help them with. So we're trying to be very flexible and understanding at the times and days that children are able to log on.
Can you give any advice to parents how to make this experience work better for their kids and for you, for the teachers?
What we tell our parents is to just take a deep breath, and as long as your kiddos feel loved at home, and whether it be reading a book at bedtime or reading with their families, talking to them about their day, like for example in math right now we're focusing on money. Okay, have your kiddo take a stuffed animal and teach them how to buy something, or go outside and practice your spelling words with chalk. So any way that they can do an alternate lesson if online is tricky, or please reach out to our teachers, please reach out to us, and we will answer any questions they have.
Great. Herb, do you have anything?
I got one question. Have you had any parents call you and say, wow, we didn't realize until now what a teacher's job is all about?
We have. It's been kind of fun. It will be kind of funny. Parents have reached out and just said how thankful they are and how they realize that we are trying, and we miss them dearly, and we can't wait until school is back in session, but they do appreciate everything that we do. So that's really helpful because we appreciate everything they do. They were their child's first teachers, so we appreciate their team effort.
Well, that's great. We really appreciate you coming in today, and I know you're wanting to get back in school, and I don't know if the kids are. They may get used to this at home, but I know the parents are really wanting to get them back in school, but we really appreciate you coming in today with that information.
Thank you, Bethany.
Thank you so much for having
Very
me.
much.
Appreciate
Thank
it.
you for being here.
Thank you.
So, once again, we try to bring in guests that are informative, and we've been doing that. So, as we said yesterday, we were going to have a question and answer session today, and we are going to do that. We always try to keep our promise to you, but first, before we get into that, I just want to recap. You saw we had another teacher today. For those of you who may be new to the briefings that we do each and every day, we've been doing this since March 14th, I think, is what Brian has told us. But we've had a host of people on these briefings that we've been trying to bring you as most up-to-date information that we can. We've had representatives from the hospitals. We've had EMS representatives on. Mental health, St. Clair County Mental Health representatives have been here. And we're going to continue to do that along with, as you saw today, people from the educational schools in the county. So we'll continue to do that. We wish we could tell you that today was the last day we had to do this, but it's not. So during our EMA portion this morning, we had our EMS call at 8 o'clock. Went well. We continue to do that each and every morning. We do have another order tomorrow coming in of PPEs from IEMA. We're looking forward to that. Much needed supplies for our first responders. Still fielding a lot of calls from people saying that businesses aren't adhering to the social distancing, and so we continue to move them on to the authorities in those municipalities and asking them to do that. So with that said, we're going to get into the question and answer part of this, as we did last Sunday. The Assistant Director of the EMA, Brian Whitaker, will give those questions, and then we'll try to get you the best answer possible. Thanks, Brian. Appreciate it.
Thank you. We've got quite a few questions that came in overnight, so we'll work through these. The first one for Sam would be, it seems that many of the reported positive patients have been female. Would you say this is correct? And if so, is there a reason why?
So as I believe is on split screen that you guys are able to see, we have a graph that shows St. Clair County cases by gender. And as you guys can see, we are at 45% male and 55% female. And national trends are showing that females tend to be a higher rate of positives than male. And I think they will be able to change this over. We also have it broken down by age. So St. Clair County cases by age. And as you guys can see, 30s, 40s, and 50s are clearly the highest age ranges that we are seeing come back positive. Earlier today, we said that we still have, 143 test results pending. So, tomorrow's briefing, Tuesday's briefing, those numbers could change significantly from today. So keep that in mind, but we are seeing right now national trends show that women are having a higher percentage rate of positives than males. Okay.
The second question would be, is there a safe way to introduce a new person into your home?
We would say, though that needs to be looked at on a case-by-case basis. Right now, we are still urging people to shelter in place and socially distance. But, if the situation is, you are needing to care for someone that is no longer able to care for themselves, or a child care situation, we are obviously saying, you still need to socially distance while in the home, continue good hand hygiene, and, we are asking people to make good decisions based on those situations.
Okay. One more while we're here talking to you, Sam. Are children now considered more at risk?
I wouldn't say they're more at risk now than they were before, but kids are out of school now. They are at home. Dr. Ezike from Illinois Department of Public Health said just a few days ago that, kids don't mean to break the rules of social distancing, but if they're outside playing and they see a group of their friends, somebody may have something interesting on their cell phone that they want to show them. And what turns out as, hey, look at this, quickly turns into having 4 or 5 or 6 kids in a very small proximity, and which, goes against our social distancing. But, we're asking guardians of children to, be vigilant, continue to stress the importance of social distancing, continuing to urge good hand washing and frequent hand hygiene. And, we will get through this together.
Okay. Thank you. The next question for Director Simmons. Could you provide a typed summary of what is discussed during your live videos for those who don't have time or don't want to watch the entire video?
I wish I could say yes, but that's a flat no. I mean, if that was the only thing that we had to do to prepare for this, we could maybe consider that, but that's not the only thing we have to do. We're here around the clock trying to keep this information coming, having to chase down a lot of the information and make sure it's as accurate as possible for you. So no, we would not have time. And that's why we have the ability for you to go back on this briefing, and you can go back and watch it anytime you want to.
Okay, thank you. Chairman Kern, a question we received very frequently is, can and will St. Clair County be sharing the numbers by city name or zip code?
So St. Clair County and the St. Clair County Health Department use IHPA guidelines that are given to us on releasing information. Initially, IHPA told us that we couldn't release to first responders the locations of COVID positive individuals. We questioned that, worked with them, worked with the Attorney General who agreed with our position, and statewide they changed that to allow us to tell our first responders, tell the police chiefs, fire chiefs, and associated people that here is somebody that's COVID positive, an address. We don't give a name, but they allowed that change. So we have asked them to consider allowing us to release by zip code. They won't allow release by cities or villages, and they said they're taking a look at that. Their problem is that they're saying the rule says it has to be a zip code of 20,000 or more. Well, we only have a couple of those in St. Clair County. So when we release something, we want to make sure we can do it countywide, have no exceptions. We want to make sure that if 62221 is released, that we can also release the zip code in Sugarloaf or Dupo or East Carondelet, and that currently isn't being allowed. We would ask them to do this. We are asking them to do this. But that being said, their belief is that just because someone lives in a zip code, that doesn't mean that's where they contracted this virus. And so you can't feel comfortable just because, well, this wasn't in our zip code or this wasn't in our area, that we're immune from this. Everyone has the potential to catch this virus from someone. It really doesn't matter where they live or where they are, whether they're rural, whether they're urban. This is a universal pandemic. It's all over the world. It's all over this country, and we have to be vigilant. We're going to try to release. We're going to release as much information as we are allowed to, but at this time, they're not going to let us release by zip code.
Well, Chairman, I think it's worth mentioning that we've had that conversation with IDPH for several weeks now, and I like the way you've explained it, because that's one of the questions that we continue to get. Why can't we release that? And the position that I've taken here at the EMA when we're trying to answer those questions is just kind of like what you said. It should make a difference where that zip code is, because people are traveling through many zip codes a day if they're not following the stay-home orders. So if that changes, if we get the response back, if the chairman does, we'll definitely let you know what IDPH tells us. But right now, we're doing as they've said.
And IDPH is Illinois Department of Public Health.
Yes.
Thank you. The next question we have says, does this virus survive in water? Meaning, will there be concerns if and when swimming pools or hot tubs open this summer?
While that is still a ways down the road and we are taking this day by day, right now there is no evidence that COVID-19 can be spread to humans through the use of pools, hot tubs, water parks, or water playgrounds.
Okay, thank you. The next question is, where can I get a test to determine if I already had COVID-19?
That is a question that I have heard frequently as well. Per the Illinois Department of Public Health, the Food and Drug Administration still has that under review. So we do not have an answer for that right now.
Okay, thank you. Chairman, the next question would be for you. Will there be an avenue to stop the sale of dispensable drinks such as sodas and other beverages at gas stations and convenience stores?
So currently, gas stations, convenience stores are exempted from the executive order closing certain businesses. They are allowed to stay open. But if we see that is a problem, if we believe that people are gathering or that there is a potential for spread because of those soft drinks, then we'll recommend to the state, we'll talk to the state, we'll talk to our state's attorney, and we'll make sure that those things are closed and no longer exist. Anything we can do to stop the spread of this virus, it's our duty to do that, and we'll be acting upon that. Just like we had to pull a liquor license of an establishment that was open and serving alcohol against the governor's executive order. We pulled the business license and the liquor license to make that operation stop.
And the next question kind of goes right in along with that. and shows kind of some of the proactive and aggressive measures that have been taken. But the question is, will there be any type of stricter enforcement of the stay-at-home order if people are not staying at home, or if determined to be a hazard to the essential workers that have to deal with people who choose not to comply or not to use the social distancing requirements that are outlined?
So if someone has been diagnosed COVID-19 positive, they are given direction from their doctor, from the medical community as to how they should act. If they are not doing that, if they're going out in defiance of that order, and we discover that, we will find ways to make them stay home. You're being told to stay home because you are a potential spreader of this virus, and you have to listen to what your doctors and the medical community is saying. So there are ankle bracelets, there are ways that you can monitor people. We choose to not have to do that. We have not had to do that yet, but those powers do exist if someone is defying those orders.
Well, Chairman, I'd like to piggyback on that too. We've in contact with all of our chiefs of the law enforcement and our mayors of the communities, and I think it's worth saying that when we have received some of those complaints that have come in, and we have forwarded those complaints on to those municipalities, those chiefs have jumped right on it, and I think everybody realizes in the law enforcement, from the mayor's office on down, how serious this is. So to answer that question, yes, if people continue to be obstinate, then they will take drastic actions if they have to.
And just as an aside, we've kept our parks open in St. Clair County because people need a place to go, and that'll be fine, and they will stay open as long as people don't start violating the spirit of that and starting to, if they start to congregate, then that's what's going to lead to parks being closed. So right now, we feel those open spaces, the bike trails, the walking trails, they're all open as long as people respect the social distancing requirement and the need to stay in very small groups to avoid the spread.
Thank you, Chairman. The next question is, were you expecting to see the numbers rise at the trend they are rising at this point, even though the stay-at-home order has been in effect for a few weeks?
We have. Dr. Ezike from Illinois Department of Public Health said just a few days ago that we have not hit our peak yet. And the last conference call predicted that around the 20th we would see our peak, but that still could change.
Okay. Another question asked, are you able to share if any cases are for people who work in stores or food services in the area?
Our data is not broken down into professions or where they work, so no, we wouldn't be able to answer that question.
Just to clarify on that, the health department does have procedures in place for contact tracing when you're notified of a positive. So those businesses, et cetera, are being notified. It's just not something that's publicly released.
That is correct.
By the Department of Public Health.
That's correct. So anybody that does come back with a COVID positive test result, we contact that individual. We find out when their symptoms started and where they were when their symptoms started, who they had been in contact with. We then contact those individuals to see if they have any signs or symptoms, and if any further action from there needs to be taken, such as testing, we will go, to the farthest extent we need to. But yes, I mean, we make everyone aware that has been exposed, and if they are symptomatic, then we take steps to have them tested.
Okay, and one additional question, kind of in that same category. Are there many cases that were traced back to the Belleville St. Patrick's Day weekend, even though it was officially canceled? Sources say there were still a large gatherings of people.
Our data doesn't work that way to specific events, so we don't know that anything came from St. Patrick's Day or not.
But we do thank the city and the Hibernians for canceling the parade. If you look at New Orleans, they went ahead with their celebrations, and they're now reaping that. They're seeing a huge spike in cases. The fact that our state came forward and said stay home, and then the parades were canceled, and all of these things, everybody started working together, government, the civic organizations, to try to keep people home. I think it will pay off in the long run here in St. Clair County.
Well, Sam, I think also that if there was a specific or some information that could be tied back to an event like that, the health department would definitely take that and look into that. But to this date, we have not had any evidence or any proof that that is what took place.
That's correct, and we would be able to figure that out through contact tracing from the person that did have the COVID positive
Yes.
test. That's correct.
Okay. The next question will be, Director, how many hours a day are being put into the response for this pandemic?
Well, here, I think the shortest hours that we've had doing this, preparing for the briefings, is probably 14, 15 hours a day. The longest has been 24. We've been around the clock. The EOC is open around the clock. We're fielding calls throughout the day, throughout the afternoon, throughout the evening, and the early morning hours. So it's a 24/7 operation. And with the staff that we're trying to keep everybody in tune to where we can bring this information. And then plus, working with the health department, the conference calls, it takes a lot to do that.
And the National Guard is also here.
Yes, we have a National Guard that's been assigned to the EOC. They're here at our call if we need them, helping with the logistics. We hope we don't need them, but they'll be here tomorrow, especially when we get the order of the PPEs in, and they'll help with that.
Okay. Thank you. The next question that came in says, Governor Pritzker has asked those who go out in public, specifically in the Chicago area, but there is some CDC guidance on this now as well, to wear masks. Mm-hmm. Should people be wearing masks in public?
So I think it's important to make a distinction. Chicago, obviously, the city of Chicago is more dense than we are right here in St. Clair County. So what the CDC is recommending, and Governor Pritzker, if you need to go out for, those pharmacy runs to pick up medication, to run to the grocery store, and you are unable to practice social distancing, that is when they are recommending you wear a mask. But if you are able to practice social distancing when you're out, a mask is not necessary. And I would like to clarify that when they talk about masks, they are not referring to surgical masks or N95 masks. We would ask that you reserve those for healthcare providers and medical personnel that are on the front lines. What Governor Pritzker and the CDC are recommending are the cloth masks that can be made at home.
And Brian, I think it goes without saying, if you are not in control of the situation, then you should err on the side of wearing a mask. So if you're going to the grocery store, you're not in control of everyone who's there. Someone may not have the desire to socially distance 6 feet. And so since you can't control everybody in that grocery store, you probably should be wearing a mask because then you're able to protect yourself from others if they're not acting appropriately.
Thank you very much. Director, this kind of piggybacks on that question, and Sam's kind of alluded to some of the solution already, but where can masks be purchased?
We look every day. And I like what Sam said, don't use the surgical mask, the N95. Those are for what we're trying to reserve for the first responders or medical personnel. But if you want to make them at home, you can go on the internet and they'll show you how to make every different kind you want to make. I couldn't tell you where to buy them at.
Okay. Another question that's come in is, will schools reopen this school year?
That's a $64,000 question. This has been, the governor's orders was pushed back to the 30th, and my understanding is a lot of the school districts have different times of the school year ending. That's a question we'll rely on the governor to make, and I'm sure he'll do that.
Okay, thank you. Sam, the next question relies about how many positive patients are in each hospital in St. Clair County?
So we wouldn't release those numbers just to protect the privacy of the patients that are admitted. We wouldn't release those numbers.
Okay. What can be done at home to help ease the symptoms of COVID-19?
So we would suggest that everyone contact their primary care provider to find out what measures are best for them. We would not want to blanket that statement by saying, this is the only way to do it or this is what's suggested. Everyone is different. Everyone has different underlying health conditions. They might be on different medications. So we're suggesting that the best way to handle that is to call your primary care provider and ask what they recommend.
Okay. We got a question that just came in on the live feed here that I want to relay because it kind of goes to the topic we're talking about. What about when riding public transportation? If you don't have a choice but to ride it, what safeguards can you take yourself while you're on the buses or trains?
As Chairman Kern mentioned, if you are in a situation where you can make the right decisions, but perhaps someone around you isn't making the best decision, a mask, the cloth-made ones are a good solution. Having hand sanitizer with you, making sure that you aren't touching any unnecessary surfaces, and when you're leaving that public transportation, when you get to where you're going, making sure that you're washing your hands. Soap and water is always the best option, but if you don't have access to soap and water, hand sanitizer that is at least 60% is the next best option.
We also had Talby Roach was here from Metro, and he talked about they have really ramped up their cleaning. So they're constantly going through disinfecting surfaces on either the buses or the trains, and they're actually going through and fogging if they do see someone who isn't acting appropriately, if they're coughing or they're having difficulties. They will actually take that bus or train out of service, make sure it's fogged with disinfectant to make sure they completely get that car or that bus disinfected. So they are acting also in the best interest of the motoring public, and hopefully together between Sam's recommendations and what Metro's doing, people are able to get to work safely.
Okay. Chairman, while you're here speaking, a question that came in was, do you ever see us getting to the point of a full lockdown?
So from what we're hearing, everything is pretty much going as expected. The peak will come in the next week or two here in this area. And so far, the hospitals have signaled that the capacity levels are acceptable. They can handle what's coming. Certainly, if things change and it looks like we're going to be ramping up and we're spiking, things can always change. Things can be locked down. They can limit more clearly what's open, what isn't, what's essential, and what isn't. But right now, I think from all indications, what people are doing is working. But they've just got to continue. We can't get lulled into a sense, well, we only had 3 new positives today, and yesterday there were twice that many. These levels, really, we're beholden to when the tests come back. So just because you see 3 one day and 6 another doesn't necessarily mean that those tests haven't been in the queue for a while. It's going to take us a little time to diagnose whether we're on the way down. And even at the point that we're seeing a decline in the number of positives diagnosed, we're still going to have to be vigilant.
Okay. Something Chairman alluded to in his statement there ties to another question that's come into us, and it is, when is our area expected to hit its peak of cases in COVID-19?
As the chairman had just stated, that for the last conference call, we are still looking around the 20th, so about a week and a half to 2 weeks away from hitting our peak. That is the information we're receiving from the Illinois Department of Public Health, and if that changes, we will certainly update you with the newest time frame in coming briefings.
Well, Sam, I want to reiterate also that we all talk about that peak, and that's the topic of conversation out there. But just because we hit that peak, it's not over with.
That is it. You hit the nail on the head. We still have to continue practicing our social distancing because just because we have hit the peak doesn't mean that it will stop as if we've hit a brick wall. We will still continue to have positives, and the last thing we want to happen is for everyone to come out guns blazing, everybody's tired of being cooped up inside, and then we have a resurgence. So our best suggestion is to still practice the social distancing, the sheltering in place until we receive the word, and that guidance would come from IDPH and the governor's office, that we are okay to start getting back to normal day-to-day activities.
Good.
Director, kind of going with that, one question that just came in on the live feed here was, other essential businesses like restaurants and grocery stores have specific guidance in place. What is recommended for gas stations to protect the public and the employees?
Well, I think they're still mandated to follow the social distancing. In fact, I sent you a video this morning, which I thought was interesting, from a Walmart store where they're actually announcing over their PA system every so often about practicing social distancing, and they've got signs put up. So these gas stations and quick marts need to be following the same thing as far as signage. And if they've got a group of individuals that are lounging around, it's their responsibility to follow that executive order and to notify the authorities. They have that responsibility to do that.
And as you talk about that, it kind of goes into another question that was asked here about, is there any action taken or considered for those residential areas that choose to disregard stay-at-home orders, such as hosting neighborhood parties, barbecues, or large gatherings in a residential setting?
Same thing goes for there. We've seen several posts come in on our page about neighbors seeing cars after cars, people out in the backyard, more than 10 people gathering for large barbecues. It's not supposed to be that way. And again, I would recommend, you want to be good neighbors, but you want to be able to have your neighbors there for you in the future. So if you've got that going on in your neighborhood, call your local department and tell them what your concern is. And like I said earlier, every agency, law enforcement in the county that we talk to, we're having conference calls with them every week, and they're all on board. Just remember, they can't be everywhere. They need the eyes and ears because we're all in this together.
Thank you. One last question we have here. Sam, you alluded to this earlier and might have answered it thoroughly, but just to reiterate as it's come through, how long does it take for test results to come back? As it seems we've seen a lot of positive results come back, and then everyone becomes panicking because on certain days there's real large jumps, other days there's not so much. Can you kind of once again explain that process and how it's fluidly moving?
Sure. So as we increase the number of people that we test, that also increases our result time. So the Illinois Department of Public Health state laboratories are working 7 days a week, and they've done that to increase the turnaround time so people aren't having to wait as long. They understand that waiting for a result in a situation like this can be very stressful. So they have ramped up their staff to be working 7 days a week to have quicker turnaround time. But right now it's approximately 2 to 4 days for turnaround time from a state laboratory. That is not a commercial laboratory, which we are not using, so I'm not able to speak on their result times. Those are just state laboratories.
Okay. That concludes what was submitted.
Okay, just to, before we close out here real quick, I want to thank each and every one of you that follow the briefings every day. We try to answer each and every one of your posts that you put on there. I really appreciate the ones that are very supportive of what we're bringing to you. Those of you who get a little testy, it's nothing personal. It's just about, everybody's safety. You heard the numbers today. The one question about can we tell you how many people have recovered? We can't do that right now. What we can tell you is there was 3 people in St. Clair County that didn't recover, and we don't want that number to go up. So it takes each and every one of us to do that. So for those of you who take your time to follow these briefings, Chairman Kern started this and he's committed. He meets with the department heads. The county still has to operate. We're doing that plus every day trying to keep you informed. So it's Sunday. I'm not going to get on a soap opera. I'm just going to say stay home, stay home, stay home. And we'll see you tomorrow afternoon. We'll be back in a few minutes with our young ladies to translate this to our Spanish communities. Thank you.